most women will get a urinary tract infection sometime in their lives. But there's a lot of different information out there as to what causes them and in turn how to avoid them. We have our Dr. Koushik to tell us some answers this morning. Good morning.
Good morning, Jenny.
So first off, we're talking about urinary tract infections. It's an uncomfortable topic of conversation, but it affects a large amount of people. Tell us, first off, how many women does this affect and what are some of the symptoms that you're getting one?
Right, this can affect most women, or at least with one urinary tract infection over the course of their lives. Upwards of 1 in 5 women actually may get more than one urinary tract infection over the course of their lives. So it's very, very common.
And so what are some of the symptoms that you're going to get a urinary tract infection? Because you wouldn't know immediately, especially if you've never gotten one before, what's happening.
Right. My experience is that actually most women are pretty good about knowing when they get a urinary tract infection, but most commonly they'll notice that they have burning with urination. Some may have blood in the urine, but usually they'll all of a sudden notice they're going to the bathroom a lot more frequently, urgently, trying to get to the bathroom, a lot of pain in the bladder area.
What can happen if you don't take care of the urinary tract infection? You let it sit there, you don't take any medicines, you're not flushing it out. Can it turn into kidney disease, a kidney infection?
Right, and what can happen is quite rapidly, especially if you have diabetes or other medical problems, is that the bladder infection can rapidly travel up to your kidneys. Then you can get something like pyelonephritis. Then when you have the fevers, the chills, back pain, that means that the infection is actually traveling up to your kidneys.
Wow.
And you need to go to the emergency room or see your doctor, quite early when your symptoms start to prevent that from happening.
So if you have those symptoms, which are, let's quickly go through some of those symptoms again so people will know. If you have those symptoms, immediately take care of them, and they are blood in the urine, you said?
Sometimes blood in the urine, burning with urination, bladder pain or spasms in the bladder area, urgency and frequency, those type of symptoms.
And then what are some things that you can do? Yes, you can take medication, but you can also do some things to kind of stave off a urinary tract infection, right?
Right, antibiotics once you have the urinary tract infection, of course, but the things that you can do to prevent them, number one is to drink plenty of fluids. If you're always hydrating yourself and fluids going in, fluids going out, you're going to reduce bacterial counts. Second thing is go to the bathroom on a regular basis. Don't hold it. Don't try to avoid going to the bathroom for prolonged periods of time. Third is a lot of people are constipated these days, sometimes without knowing it. So keep a regular bowel habit routine is the third one. Fourth one is to void after intercourse, which is very, very important. Other things that are a lot that we see in the literature is cranberry tablets. There are some, or cranberry juice. You essentially acidify the urine, making the urine hostile to the invading bacteria, and it is especially helpful in younger women, the studies show.
All right, and some people are just genetically prone to getting more urinary tract infections, right? You were saying that their immune system just isn't as effective in fighting off a UTI than other people. So just definitely do those tips, right?
Exactly.
All right, thank you very much, Dr. Shaw.